Okay. Hi, I am Dr. Priti Garg, an ophthalmologist, or what we commonly call an eye specialist. I do run well-equipped and modern eye care setup, Garg Eye Clinic, at Madhuvihar, Patparganj in East Delhi. Today, we will try and talk about some common eye ailments, their causes, symptoms, and possible treatment. I have tried to keep it simple, and the whole purpose is to create basic awareness about these so people can take timely action whenever they are faced with any issues related to their eye. I don't think so. I need to emphasize the importance of vision in our life. We all take good vision for granted, but as someone who over the years have seen all sorts of eye or vision related problems, I can only say a good vision is truly a blessing that allows us to live a normal life and enjoy the wonderful beauty of nature. And it is important that we do take care of our eyes. As I mentioned, the idea here is to create awareness about eye care, vision element, and treatment possible. These figures, as you can see, are staggering. The sad part, however, is that good awareness, some preventive steps, access to basic eye care could have helped in preventing these catastrophic numbers. This is basic eye structure. The most important parts are your cornea, the lens, and the retina, as well as optic nerve. The light from an object enters through the cornea, focuses through your lens, and received by the optic nerve, from where the brain receives the signals to create an image. Common eye problem in kids as well as in adults are refractive error, myopia, hypermetropia, astigmatism, dry eye, computer vision syndrome, conjunctivitis, color blindness, or night blindness. In case of a kids, common problems are like lazy eye, squint. In, adult age group, it's cataract, glaucoma, ARMD, and diabetic retinopathy. We shall go into a bit of details on some of just talked eye problems. Let us start with myopia, or what many of us know as short-sightedness. Here, the patient is able to see things which are close very well, but the distance vision is blurry and unclear. It is hereditary in nature and normally seen in kids nearing puberty. This is around the age of 8 to 12 years. In most cases, prescription of glasses are able to address the issue. For growing kids, susceptible because of hereditary reasons, a thorough checkup every 6 months is recommended. Hyperopia, commonly known as farsightedness. Here, near vision is impaired while distance vision may be fine. Usually occurs with age, but may be seen even in younger age group. It causes strain and patients usually complain of headache and eye watering. Prescription of glasses can resolve the issue in most cases. Astigmatism. It is caused because of the improper cornea curvature, which leads to vision distortion. It largely seen in kids, but can also present in adults, especially after surgery. It is a common cause of what we call a lazy eye for kids, usually present with headache, eye strain, and squinting. Proper wearing of glasses is the most common and effective treatment. Amblyopia, or lazy eye, as it is commonly known, a childhood condition where eyesight in one eye is underdeveloped compared to other normal eye. The brain focuses on one eye and virtually ignores the lazy eye. While there is no obvious problem with lazy eye, but the eye does not aid in vision. Normally associated with high positive number or squint and is detected in a regular eye checkup. Early diagnosis is the key factor in resolving. Typically, prescription spectacles and patching of good eye, forcing the lazy eye to work, help in this situation. Squint. Squint basically is a misalignment of eyes. Main cause is the key muscles around the eyes are not able to function in coordination. Very visible and easily noticed by parents. Can be treated by proper glasses, eye exercises, and sometimes surgical intervention required. Conjunctivitis. Conjunctivitis is usually caused by bacteria, virus, or allergy. It is commonly present as inflammation or infection in the eye, leading to red eye, though not normally affect vision. Typically, symptoms are redness, itching, watering, and discharge. Can be managed through frequent eye wash, good ocular hygiene, and treatment according to the root cause as suggested by an ophthalmologist. Cataract. Cataract is one of the most common cause of blindness in India. It is easily preventable by timely treatment. Leads to blurring of vision, problems seeing at night, excessive glare issues. Age-related degeneration is the most common factor, but systemic conditions like high blood pressure, high sugar, and also problems like high myopia and injury to eye can cause this. Cataract surgery has advanced a lot. It's a J-care procedure without any need of hospitalization, done in local anesthesia, and is a stitchless surgery. In this, cloudy lens is replaced with artificial lens. Success rates are almost 100%, and good vision is regained within a month. Glaucoma. Glaucoma is a serious eye condition. It causes damages to the optic nerve. Normally, it is caused by high intraocular pressure in the eye, as the eye is unable to drain excess fluid. This extra pressure causes irreversible damage to the optic nerve. That's why it is called silent thief of sight. People having family history of glaucoma, age more than 60, with medical conditions such as diabetes, high BP, or heart disease, high refractive glasses, people gone through eye surgery of certain type, or who has had eye surgery, or those taking corticosteroid medicines such as eye drops, etc. for a long time. They need regular and thorough eye checkup for a trained ophthalmologist. A proper examination by a specialist where measurement of eye pressure by tonometer, inspection of eye drainage angle by gonioscopy, optic nerve evaluation by OCT, peripheral vision detection by automated parimeter, measurement of thickness of cornea by pachymetry are checked by a doctor is critical for proper assessment. Glaucoma is managed by bringing down eye pressure. The intervention include medication in the form of eye drops or tablets, laser, surgery, or combination of all these. Also, a regular checkup at periodic interval is must. Corneal ulcer. Corneal ulcer is nothing but an open sore on the top thin clear layer on the colored part of the eye. This is our iris, normally caused by infection or injury. Infection could be bacterial, viral, fungal, or parasitic, or even allergic. Typical symptoms are pain, redness, watering, foreign body sensation, and glare. Can be treated with medication depending on the cause by frequent application of eye drops. Surgery for cornea transplant may be required in extreme cases. Age-related macular degeneration. or ARMD is the fourth leading cause of blindness. It can lead to significant loss of near vision and sometimes even complete loss of vision. Typically seen in older people, periodic eye examination, including fundus examination, is important for early detection. It is of two types: dry eye, more common, and does not need any specific treatment. Wet requires injections to slow or stop the process. ARMD diagnosis is done by the help of OCT or fundus fluorescent angiography. Diabetic retinopathy. This is a diabetes complication and a typical effect of prolonged diabetes. Causes damage to blood vessels of light-sensitive tissues of retina. While usually starts with no or mild vision problems, but can lead to blindness. Initially may just present itself as a spot or dark strings known as floaters, blurred vision, fluctuating vision, dark or empty areas in your vision. People with diabetes should ensure proper sugar control and periodic and thorough eye examination. Eye strain. Eye strain problems have multiplied significantly as the screen time on phone, computer, and TV have increased rapidly in recent times. It can be annoying. Overexposure to screen times lead to stress, strain, blur vision, redness, watering, headache, irritation, itching, burning, etc. These patterns are self-explanatory. It interferes with basic quality of life. Prevention is the best cure. Maintain distance and right posture from screen. Keep screen brightness low. Give short breaks to your eyes. Reduce avoidable exposure. Increase blinking rate. Just to summarize, eye is an important sensory organ, and a healthy eye and good vision is critical for good quality of life. It is important that a yearly discipline of thorough eye checkup is taken as a good precautionary practice which can help detect and support treatment of anything which may not show up with visible symptoms but can cause serious damages. That's why it is called prevention is the best cure. Lastly, I appeal all of you to pledge to donate your eyes and help visually impaired to appreciate the creation of nature. For any queries, please contact me at dr.pritigarg@gmail.com or visit my website www.gargeyeclinic.com. Thank you. Stay safe, stay healthy.